Welcome everyone. I hope all of you are doing well. In this video, I am going to talk about on how to nebulize the patient. But before nebulizing the patient, there are some indication and contraindication of nebulization. The first indication that the patient should be nebulized is asthma. When the patient have asthma, the patient should be nebulized. And when the patient has COPD, chronic obstructive pulmonary disease, so the patient should be nebulized. And when the patient have breathing problem, when the patient have difficulty in breathing problem, the patient should be nebulized. And when the patient have cystic fibrosis, and when a large amount of medication is required directly into the lung, then the patient should be nebulized. Now there are some contraindication. Obviously, when there are indication, there is also contraindication. So the first contraindication is when the patient has hypersensitivity to the aerosol form of the drug. So the patient should not be nebulized. Drug. And when the patient have certain lung condition, like when the patient have pneumothorax or when the patient have internal lung bleeding, so the patient should not be nebulized. And when the patient is pregnant, try to get pregnant, so the patient then should not be nebulized. Now, how to nebulize the patient? Nebulizing the patient, you should have to the nebulizing machine. This is the nebulizing machine you can see over here, and you should have the required drug. You can see over here, this is the drug which is used in nebulization. Now, there are some drugs that are used in nebulization. These drugs include the bronchodilator. The bronchodilator drugs include the salbutamol, salmeterol, and albuterol. And apratropium and tiotropium is also in nebulizing the patient. And there are some other drugs like antibiotic such as the gentamicin or tobramycin are also used in nebulizing machine to deliver directly into the lung. Because the drugs that are used in nebulization machine to deliver directly into the lung. So now how to nebulize the patient? For nebulizing the patient, you have to insert the switch into the plug. So I have insert switch into the plug. Now this is the medication chamber, and you have to insert the medication directly into the chamber. So I'm going to insert the medication into the medication chamber of nebulized machine. Now I have placed the medication into the medication chamber. Now feed the face mask over the medication chamber. Now feed the face mask to the patient mouth. We have two types of face mask. One is child size, the other is adult size. This is the adult size face mask. Now start the machine by the on off button. Now the machine is starting and the patient is getting nebulized. So for how much time the patient should be nebulized? For about 5 to 20 minutes the patient should be nebulized. So this was all about nebulizing the patient. So thanks for watching the video, and don't forget to subscribe, like and share.